Thank you for having me here today, and thank you everybody for coming and listening to me talk about our post-overdose response team. We've been doing some really awesome work over the last couple of months. This is a new program that the county has implemented. We started August 26th of 2023, so like I said, only a few months in the making, but our peer support specialists and the rest of the PORT team with the health department and along with all of the other agencies in the county, including law enforcement and EMS, our hospitals and so on, have worked really well with us to help create such a successful so far program, and being able to work together and create great partnerships is always really important when you do anything like this. So super thankful for everybody in the county that we have created a positive partnership with to implement the post-overdose response team. So I'm going to start the presentation off with a little bit of background on opioid statistics, kind of laying out the landscape of what the opioid epidemic looks like throughout North Carolina and for Carteret County specifically. So there are about 40, so Carteret County's post-overdose response team was the 44th post-overdose response team to be implemented in North Carolina. Other states have post-overdose response teams. Carteret County, we use the DOJ settlement money from the opioid settlement to fund our PORT team. So that's kind of why we're just getting one up and going. Carteret County, even though we're the 44th, we are very different and unique from other post-overdose response teams because we respond in real time to overdoses in the county. I'll get into that a little bit further into the presentation, but other counties are not seeing as a successful rate as we are, which again I'll get into, and a lot of that does have to do with us responding in real time and doing something different than other counties have been doing. All right. So Carteret County, you can see is in the corner down there at the most southern part of the Outer Banks. We see 38.9 overdoses due to prescription medications, or due to medications and overdose deaths per 100,000 population, compared to 27.6, which is statewide. So you can see Carteret County is well above that average overdose death rate compared to the rest of the state. If you look around Carteret County as well, you can see that surrounding us are those darker areas as well. So Carteret County is suffering, and then a lot of that is also being absorbed from our surrounding counties having a substance use problem as well. So from 2020 to 2021, North Carolina saw a 26% increase in overdose deaths. 11 North Carolinians die on average every day in North Carolina due to an overdose. And then in 2021, 96% of all reported overdose in North Carolina were unintentional. So these were not suicide attempts. These were not people that when they used this substance thought they were going to be ending their life when they used it. From 2020 to 2021, there was a 12% increase in ED visits. So one of our goals with the PORT team is to help lower the burden that our emergency rooms are seeing as well, because we have a lot going on in our emergency rooms, and we saw that with COVID and the influx of patients in the emergency rooms. Our nurses and doctors and other medical workers and providers have a lot going on, and then with this increase in opioid overdoses as well has really put a burden on our emergency rooms. Rural counties have seen a 95% increase in opioid overdose deaths from 2017 to 2021. Urban counties in North Carolina saw about a 69% increase in their overdose deaths. So this is a healthcare issue that is really having an effect on our rural communities, but overall the entire state, doesn't really matter if you're urban or rural, has seen an increase and an impact from the increase in opioids in the communities. 93% of opioid overdose in 2021 involved illicit opioids, predominantly fentanyl. And then for 2023, there was 2,838 fentanyl positive deaths in North Carolina alone. So that's 2,838 families in North Carolina that were forever changed last year. This graph I included here, I find it really, really interesting, and I love to include this to talk about it because it really shows kind of what's going on with the drug supply in the communities. So these are the last 12 months of fentanyl positive deaths from the toxicology reports. So what other substance that they had in their system. So every line on here is fentanyl in somebody's system as well, but these are also the other substances that they had in their system too. That red line you can see is the number one most likely substance somebody is to have in their system, and it's cocaine. Right under that, the orange line is the second most common to have someone to have in their system when they die of a fentanyl positive overdose, and that's methamphetamine. So if you know anything about the chemical kind of makeup of these substances, you know fentanyl is an opiate depressant. It's going to have more of a downer effect. Cocaine and methamphetamine are stimulants. They're going to have more of an upper effect. So why would these be the most common substances that someone has in their system when they die of a fentanyl positive overdose? So this tells me one of two things could be happening in these situations. So one, when somebody uses substances, they have a substance use disorder, if they're using methamphetamines or cocaine, they're probably not sleeping. They can't sleep. A lot of times when people use methamphetamines, they're up for 4 or 5 or more days at a time. And so they'll use downers like heroin or fentanyl to try to go to sleep after being up and being exhausted. So that could be a scenario that's going on. Or people could be using what they think is methamphetamine, what they think is cocaine, and there's really fentanyl being laced in these substances as well. I'll tell y'all the first 3 overdose calls that we responded to when we implemented, the individuals that we responded to thought they were using methamphetamine or cocaine. That's right here in Carteret County. So fentanyl is cheaper. It's completely synthetic, can be made in a lab, and it gets people addicted quicker. So it's for people who sell drugs, it's a really great filler for these substances for them to make more money and not use as much of their product. So here's some more Carteret County specific data. So Carteret County is 3rd in eastern North Carolina for overdoses. We have seen 24 overdose deaths in 2023. The year before that, we saw 31 overdose deaths in the county, so we have had a slight decrease. Carteret County EMS responds to an average of 25 fatal and non-fatal overdose calls a month. Of those overdose calls that EMS responds to, so in 2023, EMS responded to 301 overdose calls, and about 50% do refuse to go to the emergency room. Approximately 1 in 12 overdoses in the county are fatal, and then 32 opioid overdose deaths per 100,000 North Carolina residents compared to 22.7 statewide. So again, this data is just specific to opioid overdoses. It doesn't include all overdoses like that first number I showed y'all. You can see here Carteret County is still way above that statewide average for opioid overdoses as well. Our ED saw 95 opioid overdoses, overdoses in their ED were substances with a dependency potential, and that data just goes to September of last year, and then 44 EMS encounters for a suspected opioid overdose. And that's just opioids again, that doesn't include other substances that individuals could overdose on. This chart here I like to include because in case you're just a numbers person, this only includes our estimated lifetime costs for individuals who have an opioid overdose death in the county. So this doesn't include the non-fatal overdoses as well, and it just kind of shows the medical costs and the statistical lifetime savings costs. So this includes like loss of work, productivity to society, and things like that. So you can see it costs about each resident in Carteret County $5,500. Again, another chart specific to Carteret County. I like to include this one because it really shows when the heroin and fentanyl became more potent to where it was causing an increase in these overdoses with the introduction of fentanyl into the drug supply. So that's the dark blue line that you can see that has a pretty exponential increase there. Starting around 2013, and then you see in 2019 it shoots up pretty rapidly. So where are overdoses happening in the county, or not in the county, in North Carolina? Most overdoses happen in private residence, 61%, but the second most common place for an overdose to happen in North Carolina is a service station, gas station, things like that, 12%. 11% of our overdoses happen in highways, streets, and vehicles on the side of the road, things like that. I think it's really important to include this because it shows that you could run into somebody, even if you're not impacted by substance use in any way, it's not in your life, you can still run into somebody at a gas station, parked in a parking lot. I have a situation that happened a few weeks ago. Is my boyfriend was at Walgreens in the county, and he was walking in, and there was somebody that it was pouring rain, and they had their window down in their car, and they were knotted out. And he ended up having to call 911, and they had to end up meeting with that individual, helping them get some help, and they had overdosed in their car in the Walgreens parking lot. And besides what I do for work, he has never encountered anything like that before. So just an example that could happen to anybody. So what is a post-overdose response team? A post-overdose response team is a follow-up program that provides outreach, engagement, resource navigation, and other wraparound services necessary to individuals after they have experienced an overdose or for individuals at risk of experiencing an overdose. Follow-up programs conducted within days of a naloxone reversal can provide opportunities to direct individuals to services in county and out of county, try to help them get hooked up with treatment services, reduce or stop their substance use, and it's opportunity to provide overdose prevention training. It's opportunity to provide them with naloxone or Narcan training, other overdose prevention materials. It's an opportunity for our stakeholders such as EMS and law enforcement and hospitals to work together and bring kind of all of our heads together and all of our resources together to try to reduce overdose mortality and prevent any future overdoses from happening in the county. So who can benefit from port services? So I have a lot written here, but short and sweet. Pretty much we have no exclusion criteria except for they have to physically be in Carteret County. So we will help individuals under the age of 18. We will help individuals who have just been incarcerated and released from jail, that have tried to go into treatment before and weren't successful but would like to go back and would like to try something new. Anybody that has a substance use disorder and is ready for help or would like some guidance on how to get some help and to ultimately reach recovery, we will provide services to them. Another thing that's really important for us, if you have ever been impacted by substance use, if you have somebody in your family, and 1 in 3 households in the United States are impacted by substance use now. So y'all can look around the room and do the math on how just this room is probably impacted by that statistic. But if you've ever been impacted, addiction causes chaos. Addiction causes heartbreak and so many just negative emotions within families and just trying to get this person help. But we know that the person has to want it for themselves. No one else can do it for them. But because of that, we provide services for family members as well. We don't want to just focus on the person that's using substance, because yes, that is very important and that's ultimately what's going to help the entire family unit, but we also want to provide services to family members as well. So if that's connecting them to counseling services, if that's connecting them to support groups like Nar-Anon or Finding Hope with One Harbor, there's lots of different support groups and agencies in the county that can help. I mean, I'll talk about our peer support specialists, but even having them just come and like talk to family members sometimes and explain to them maybe what's going through their loved one's head and maybe why they're acting like this, because it doesn't make sense, and helping reassure them that what's going on isn't supposed to make sense, can be extremely helpful in these really hard situations that families go through. So how is our PORT team structured? So I talked a little bit about our PORT team and how we're unique with responding in real time. But the individuals that are actually responding are our certified peer support specialists. So we have 5 certified peer support specialists on our team, and then myself, so a team of 5. I'm the team navigator / manager. I provide support and leadership to our peer support specialists to help them navigate different resources, working with individuals, coordinating and developing different overdose prevention techniques and efforts in the communities, maintaining relationships with our community partners, providing just kind of day-to-day activities and answering issues, concerns. I analyze data, which I'll show y'all at the end here, some of the data that we've produced so far, but more of just like the logistical administrative stuff I kind of work with, and I will touch briefly on, I do work with the county schools to do substance use prevention in the high schools and the other local county schools in the area as well. So that's kind of like the other half of my job. So I have like my port side of my job and then my school side of the job. But our peer support specialists, they're the ones that actually have the boots on the ground, going out in the field, working directly with our EMS and our law enforcement, our hospital, and the individuals who have experienced overdoses. What a peer support specialist is and what makes them unique is these are individuals who are in recovery themselves from substance use. So how you become a peer support specialist is you have to have a certain amount of time in recovery, and then you take a 50-hour class that is provided by the state. Once this class is completed, you have the certification of completion. It is sent in along with other application material to the University of North Carolina at Chapel Hill. They review the applications, and then they either approve somebody to become a certified peer support specialist or they don't. So everybody that's on our team has been approved by the state of North Carolina to be able to use their lived experience to help others that are going through similar situations. So our peer support specialists, they provide individual coaching, mentoring, promoting self-direction, promoting recovery and self-advocacy with these individuals that they work with. They also go out into the community and do outreach and provide awareness in the community. They, for example, last fall, they were at the community college during their fall festival. They had a table there and they talked to students and faculty and other individuals who attended to answer questions and educate the community about PORT and what they do. They provide referrals to treatment and recovery resources in the county and the outside resources. They listen and connect with individuals, with family members, to try to meet these individuals where they're at, to provide services that go in the direction of recovery. So again, how we're structured, I said that we respond in real time. So this is what we would call an immediate response. So how it works is our entire PORT team, we have an active 911 app on our phones, on our work phones, and every time there is an overdose call that goes out, EMS receives that call, law enforcement receives that call, and now the PORT team receives that call. So we respond in real time, right, with EMS and law enforcement. Obviously, we don't have lights and sirens, so we're usually the last ones on the scene. But I would say about 85–90% of the time we're able to get there while EMS, law enforcement is still there. EMS, law enforcement, they do their thing. We stand back, and once the patient is stabilized, they'll come and get us, and our peer support specialist will go in. If they are transported to the hospital, then we'll follow them to the hospital. We have a MOA, a Memorandum of Agreement, with Carteret Healthcare that we can go into the emergency room and we can meet with clients in there once they're stabilized. A delayed response is when an overdose call comes in outside of our shift hours. So our peer support specialist works 7 days a week from 8 a.m. to 7 p.m. So for 10 hours a day, 7 days a week, there is a peer support specialist in Carteret County that's ready to respond to emergency situations. So if an overdose call does come in between those hours that we're outside of shift, we will still receive that call that night. When they come in at 8 o'clock that morning, they'll see that call, they'll contact communications, get information that they can from communications. We have the address that the call happened at. We'll go to the address and try to meet with the person there if it was in a private residence, and try to follow up with that person less than 24 hours later. We also take referrals, so I like to emphasize that somebody doesn't have to overdose for us to help them. We take referrals from the individual themselves, from loved ones. We'll take referrals from the hospital. We've gotten referrals from law enforcement. If they have somebody that they've kind of been working with for an extended period of time, maybe they're not necessarily overdosing, or they know that this person is overdosed, but they didn't call 911, it was a non-fatal overdose, then they can refer that individual to us as well. How a referral is made is we have this 1129 number down here, and then we also have an email. Whenever this 252-247-1129 number is called, every phone on the port team rings. So all of our desk phones ring and all of our cell phones ring. So somebody will get up with that person, and either be able to respond immediately or less than 24 hours later. I don't even really like to say less than 24 hours later because it's really going to be sooner than that, just our gap to give us some room there. But that is how we get in contact with clients that are needing port services. So our goals of Port is we want to be the triage of Carteret County for overdoses and substance use. Dr. Williams has kind of been the brain behind this, our Consolidated Health and Human Services Director at the Health Department. And how we came to deciding that a Port team was what we wanted to do with our opioid settlement money was Dr. Williams did a gap analysis with probably over 60 entities throughout the county. And one of the things that they kept saying was that when somebody is having a substance use crisis, when a family has somebody that is suffering from substance use and they don't know where to go either, if somebody themselves is suffering and they don't know where to go, why is there not one number to call? If you get in a car accident or any other kind of medical emergency, you call 911. You don't have to try to figure out, well, do I call Emerald Isle? Do I call the county? You can call one number and they're going to direct you to the services that you need to be able to help you for those medical emergencies. So that's kind of what we want to be, but for substance use in the county. If somebody finds themselves in a situation where they're using substances, it's out of control, if a family member, if a parent finds out that their child has been using substances and they've come to them and they need help, we want them to know that this is the number that you call to get connected with services and not be running around trying to do everything themselves, going back to their family members. So many of our families in Carteret County are trying to be caseworkers and case managers for their family members who are struggling with substance use. Let us be your case managers, and family members can be family members, and they can provide support. They can be parents, they can be children, they can be grandparents to these people that are suffering, and no longer having to try to just fix and fix and fix and not really know what direction to go in. We obviously want to decrease our fatal and non-fatal overdoses. We want to decrease our utilization of our hospital, of our sheriffs and law enforcement, of our EMS, because like I said earlier in the slide, our EMS, our law enforcement, our emergency rooms have had a huge burden, a huge influx of overdose and substance use patients. So we want to be able to kind of help take that burden off of them. We want to increase our community knowledge and engagement when it comes to programs like PORT and other substance use programs and prevention programs, increase our prevention efforts, increase connection to treatment, and increase naloxone or Narcan distribution in the county. So has anybody heard of the Rat Pack studies? They were done in like the 1970s, I believe. Well, in this study, basically, you might have heard the TED Talk about this, but basically what their research determined is they had rats that were in cages by themselves. So no other toys, no other rats to play with, and they had two drinking systems. One was just water, and one was water and morphine. Well, almost 100% of the time, the rats ended up killing themselves with the morphine water when they were isolated and when they were by themselves. They then took rats and put them in a community cage where they had stuff to play with, other rats to play with, mazes, and they still put the drinking water that had the morphine and just plain drinking water. And virtually none of the rats killed themselves when they had community, when they had connection, when they were able to interact with each other. So you'll hear the opposite of addiction is connection because of those studies. So that's kind of what we do here with having these peer support specialists that we can connect these individuals with in these times when they're at their lowest. Connect them with an actual person, a physical person that they can talk to and they can confide in and they can ask questions to, and not giving them a piece of paper with some phone numbers on it and telling them to figure it out. So now I'm going to kind of get into our impact so far and all the work that we've been doing in the last couple of months. So I just updated this slide yesterday. So we have received 86 overdose calls since August 26th. We have received 136, but 50 of these were called off. When a call is called off for PORT, that just means it wasn't a true opioid overdose. So it might have been like someone's kids got into some melatonin gummies and they called 911, and it's not actually an overdose where we need to be present for. So that's just what that means. We've made contact with 75 of these overdose calls. 11 we've been unable to make contact with, putting us at an 87% contact rate. That number in other counties that don't respond in real time sits at about 5 to 10%. So, because they get their numbers, or they get the referrals from law enforcement, from EMS 2 to 3 days later. A lot of times those individuals have kind of already moved on, or their phones are disconnected. So because we respond in real time, we're able to make a connection with a really high number of these individuals. We've received 69 referrals so far. A lot of these referrals do come from our hospital, but a lot of them are also, probably our number 2, are self-referrals. So people who have a substance use disorder have been given our number by somebody and have contacted us asking for help. We've made contact with 100% of the referrals that we've received. So this totals 144 individuals that PORT is connected with, so 93% when you add the referrals and the overdose calls together. Of these 144 individuals, 12 have been repeat clients. So that means these are individuals that we've either received multiple overdose calls for, or they've been referred to us and then we received an overdose call for them. Different situations and scenarios that it could be, but 144 individuals that we have been able to provide services to. At the end of January, we had helped 41 individuals in the community get into some form of treatment in the county. And we've worked with many others. They just might not be ready to enter into a detox or something like that. So they don't get included in that 41. But 41 individuals, we've gotten into detox, recovery homes, agencies like that. And this chart here is one that I made, and this just shows the time of day that we receive overdose calls. I like to add this because there's no order to it. And it can kind of give you kind of a different idea of what it's looking like with EMS and law enforcement is responding, and now Port, to these overdose calls. They happen all times of the day. If you're like me, when I started this, I was thinking, oh geez, 2, 3 a.m., we're gonna be getting overdose calls like crazy, like what are we gonna do? And honestly, most of them come in later in the afternoon, before 9 p.m., honestly. This can be for multiple reasons. People have maybe used 2 or 3 times a day, and that last time that they used is the one that set them over the edge. Maybe they've been at work and they've come home and they've used and set them over the edge. So multiple reasons, but really there's no order to it. Overdoses happen all throughout the day. Again, it's just another form of the chaos of addiction. So we've also distributed 381 units of naloxone or Narcan to the individuals we work with and different community agencies. Every library in Carteret County has naloxone or Narcan now because the Port team was able to distribute it to them. We saw that where our overdose is happening. The 4th on that list was public buildings. So places like libraries. So that was why we reached out to them to provide them with Narcan. We provide Narcan to some of our service stations in the area, some of the restaurants in the area, to individuals that we work with. In 2021, 69% of overdoses in the county, or not in the county, in North Carolina, had a bystander present. 69% of overdose deaths, there was somebody there. Naloxone or Narcan was only administered 26% of the time. So that means these individuals maybe didn't have it, didn't know how to administer it, whatever it was. But if these individuals had it, were able to administer it and call 911 and use it correctly, those lives could have been saved. Because what Narcan is made for is to buy time for EMS to get there, to keep an individual from breathing again until they can get connected to medical services. We've educated over 1,000 individuals in the community through outreach at 90+ agencies in Carteret County. When we started the Port team, before we started responding to calls, myself and the team contacted probably 50 agencies throughout the county that works with substance use, and asked if we could come sit down and meet with them and talk to them. And we did, and we talked to them about what Port was going to do to just kind of get the word out about this program that was coming to the area. Again, we have an MOA with Carteret Healthcare, so we're able to go into the hospital and provide services in there. Again, that has been a game changer in allowing this to be a successful program because we're able to get individuals help before they're discharged from the hospital. Myself and Mr. Jimmy Machitness and Stephen Ray have hand-delivered consent forms to all the EMS and fire stations in the county so that EMS and fire station is able to communicate with us about what's going on with these clients. And this is just kind of an example of a naloxone kit that we may give out to individuals. So who can help? In short, everybody. Like I said with the Walgreens story, everybody in our communities is impacted by this now, just because it happens all over. We work really closely with our EMS and law enforcement. They've been great to work with. I'll share a quick story that a few months after we had implemented, probably about 3 months in, one of our peer support specialists was responding to an overdose call, and she was sitting back waiting for EMS to do their thing. And EMS actually ran out of the house and looked at her and said, "We need you in here right now." and grabbed her and brought her in, and they were able to connect with that individual, get them services, get them help in a way that EMS or law enforcement wouldn't have been able to, or may not have been able to. We work with Carteret Healthcare, we work with other substance use mental health agencies, Port Health, which is different from us, that's in Moorhead, and other agencies throughout the county. We work with them. We work with Hope Recovery Homes. We work with Hope is Alive. We work with One Harbor. We work closely with CCATS, providing transportation. So my background is public health, and if you're into public health like I am, you know, in rural health, the #1 barrier is always going to be transportation. So I'm super thankful for CCATS helping us provide transportation services to individuals in the community to get them to treatment. Because a lot of these individuals might not be able to get to detox. I mean, our closest detox facility for the county right now is in Jacksonville. So if you live in the Down East area or even in Beaufort, Moorhead, that's over an hour drive. And if you don't have transportation or reliable transportation, I mean, you're kind of out of luck. So really awesome that they've been able to work with us to provide that transportation option. So these are our team members: Heather, Angie, Danny, Jesse, and Amanda. This is a full team, again, 5 peer support specialists that we work with. How to make a referral, call our port number, or email us. My email is brooke.barnhill@carteretcountync.gov. Any questions or anything related to a port team, please feel free to contact me. I have cards. I'm happy to answer any questions anyone might have. So, thank you.